will travel just like every other month in our catchment area.
Yeah.
To like these brochures. Kelly is my in-reach outreach coordinator, but I printed them, which I'll show. But once we get them, we have the order in to be formally printed, and they'll be colored.
Okay. My name is Tricia Bear. I'm the DAV and VFW service officer. And this morning we have a guest, Michele Reeves. She's the Women's Veteran Program Coordinator or Manager from Tulsa and Muskogee. And she's here today to inform veterans, women veterans, about their benefits. Good morning, Michele.
Good morning, Trish. How are you?
Good. How are you doing?
I'm good, thank you.
A few questions I have for you today. What does the Women's Veterans Program provide for the women veteran?
So very many wraparound services that we provide for our female veterans. I think one of the most important things, and it's been a national campaign from Office of Women's Health, is that when the veterans show up, we want them to feel safe, secure, welcome, respected. We want them to have fair and high quality, equitable care that we would provide our male veterans. We also work with the CBOC locations and the primary care providers to make sure that anybody, whether it's a primary care provider or an RN or an LPN that would be on your primary care team, has gone to official training that the Office of Women's Health holds. And we also have had that locally with a rural mini residency, and we've trained like 35 primary care providers and close to 40 nurses. So that trains very unique women needs, which would be abnormal uterine bleeding, breast illness things, just all things that are even cardiovascular disease that would be very specific for a female veteran. So it's very important that the people that care for our women veterans have that specialized training.
All right, that's good to know. What educational background and experience do you have?
So I've been a nurse for 36 years. I started out with an associate's degree from Rogers State College in Claremore. Went straight into work for surgery at Hillcrest Medical Center, where I stayed for 17 years. Then I transferred over to Southcrest, also in surgical services. So for 33 years, I've done surgical services and nursing management for that. I've been at the VA for about 3.5 years, started in the surgery department, and then when this job became open, I took it. And I love our job. I love it. I love the mission of providing the care that the women veterans need desperately, and that certainly they deserve.
Yeah, and they may not know about those benefits, which I'm finding as a service officer, a lot of veterans don't know about their benefits, and they don't know how to get those benefits. So that's what we help them do. On the Prepare program, what is the mission and resources for the Prepare program?
So the Prepare program we started about 16 months ago. It was originally rolled out in Florida at their VA healthcare system. So we're very excited to be considered a rural VA healthcare system and to roll this out. So it is in great collaboration with the Women's Mental Health team and Dr. Tricia Bear and her staff. So it's wraparound services that we provide at our CBOC locations and the main facility in Muskogee, Jack C. Montgomery. And it could be chaplain services, nutrition services for pregnant ladies that, need a higher caloric intake. Eventually, we would like to we have a dietitian that works with us and have healthy cooking classes for those of pre-childbirth and even postpartum needs for ladies who are lactating. Our maternity care coordinator, Miss Michaela Clark, we'll talk about her a little bit. You have a question for her specifically, but she very recently obtained her certification to be a lactation consultant. So we're very excited to have that service that we can offer the ladies who have just had a baby. It is very specialized individual and group sessions. It could be related to infertility issues, not being able to get pregnant, having miscarriages, a stillborn, an infant loss. It could be helping ladies that are on mental health medications and they have concerns about being pregnant and the safety of the baby while on those medicines. So we have a specialist, Dr. Gary Sweet, who would have a conversation when the primary care physician puts a consult in that lady is pregnant. It goes to the prepared team. They contact my maternity care coordinator, Miss Michele Clark. We'll call that veteran and see what her needs are. Does she need to know about nutrition stuff? Is she thinking she's going to breastfeed? The Office of Women's Health provides these moms with it. We call it the purple book because the writing on the front of it is purple. So it's everything you'd ever want to know about pregnancy. How much does a baby weigh at 4 weeks and 8 weeks, and what you're going to be experiencing. Just really anything that we can provide that lady, kind of like a one-stop shop for all of these services. Very soon, we're hoping to start infant and child CPR. Another nurse on my team. We wanted to start in November, but it's something as simple as letting a VA computer open that zip drive. And there's so many firewalls in the VA system that we're having to work through. But we have all the supplies and everything that we need to start that infant and child CPR. And that will be free to the mother and whoever she designates that she wants to come with her, whether that's a spouse, the father of the child, or it could be a grandparent or a caregiver of any kind. So really just wraparound services. And the mission really, again, is the one-stop shop with whatever services literally that population tells us that we need. If we have a way to provide it, we're going to try to make it happen.
Okay. That's outstanding. It really is how
Thank
much you
you
all support veterans and women veterans.
Yes.
What website can women go to in order to get their monthly newsletter that you send out?
So it's not a website that we go to. So Kelly Zimmerman, who's my in-reach outreach coordinator, makes that monthly newsletter. It goes to our VISM, which is kind of mid-VA, and their creative team. They make it look pretty, and they send it out to the .gov delivery list.
Okay.
So it's my understanding that when you first got out of active duty, you would have checked a box that said you wanted to get information from the VA. Now, I will tell you that Kelly worked very hard to get a UR code, and I have copied that. So the answers that I have developed for these questions, I will send to you via email that you can hopefully post, and that UR code will be on that. They can take their camera on their phone to that UR code, and it will have the past newsletters that we have sent out so they can view all of them. That QR code is also very important because it's linked to multiple resources that either locally, VISN-wide, or even nationwide, very specific women veteran resources at their disposal in that QR code. So that will be very important for them to check out. It's very beneficial.
Okay, so what we can do here at Guardian of Services program, we can post that information on our page, our YouTube channel page, and that way anyone who wants to see that newsletter will have a way to get that information.
That is awesome because we definitely, it benefits. Important to note that the Office of Women's Health nationally has a monthly campaign, just like February is Go Red. So February the 7th, we encourage all women, and really not women, everybody, to wear red on February the 7th. That's a Friday. Okay. And it's just alertness for women veterans, not just veterans. This is like a national campaign, even not just for veterans, but that women have unique signs and symptoms of a heart attack different from what men do. So it just brings awareness to Go Red for women specifically when it comes to heart disease. So other monthly campaigns, of course, October would be Breast Cancer Awareness Month. January has been Cervical Cancer Awareness Month. So a lot of that information is what Kelly goes on our SharePoint at the national level to get that important information. That national office has, done all the research, done all of the article reviews to come up with this the latest information that's very pertinent to our women veterans.
Okay. All right. The HEART program teaches about VHA, VBA, and HCA. Can you explain the difference in those programs?
So I didn't find in the HEART book HCA, but definitely I think you probably have come across it, and certainly I have, that veterans get confused. VHA, which is Veteran Healthcare Administration, which is what my team works under, Veteran Affairs, VHA. So it's my understanding that when a female is going out of active duty, she's given a folder with so much information, they don't always understand exactly how to fill out the form to sign up for VHA. So if you go to either Jack C. Montgomery, because you're in our catchment area, or at Ernest Childers in Tulsa to the business office, they have men and women that will help veterans sign up for healthcare administration. So that gives you, and there are so many little caveats to the healthcare, but they have the latest information on that. What's important then, the VBA, which is Veteran Benefits Administration, is when you go, we have a regional office in Muskogee, Oklahoma, so you can make an appointment with one of the clerks at VBA. That is a totally separate process and form that you fill out with them, and that would be your service-connected conditions. And then you have an appointment with the physician for that service connection. It goes before a board. It's either approved or not approved. And that is the benefit then of getting your monthly payments from the government for the service connection that you have. So they just need to understand your healthcare benefits versus monthly entitlement benefits are two totally separate processes. The other HEART benefit talks about national cemetery. So the government would pay for a veteran or spouse when they pass to be buried in a national cemetery. So as I was doing my research, there is one in Fort Gibson, Oklahoma, and then there was also one in Elgin, Oklahoma. So that is also, so I will give to you, and I apologize, I left it in my office, but when we also get these brochures, I have the HEART books that, again, the Office of Women's Health has made. It's probably 75 pages of information that talks about every resource for a female veteran that is put out by local VISN and the national office. So I will get you that information also that then you can share with the veterans.
Okay. And the VBA, which you talked about, was the benefit manager part. That's what I do. I help veterans do their paperwork, educate them on different benefits, such as the VA disability compensation, and show them how that process works. And then I fill out the paperwork for them for free. So it doesn't cost any veterans any money whatsoever.
That's correct.
My phone number is 479-414-0952. And that's why we created this program, the Guardians of Services program. So that is our way to educate veterans, all veterans, on their benefits and how that process works.
So I also have the number for the regional office if someone was closer to Muskogee. So the address is 125 South Main Street in Muskogee. It is 1-800-827-1000.
Right, and that's the VA regional office there in Muskogee. It's in the federal building.
Yes.
It's right across the hall from the DAV. The DAV, our headquarters for Oklahoma. They have the VFW and other organizations. I work specifically for the DAV when it comes to helping veterans with their paperwork. Everything else, like we do Feed the Vets every 90 days, where we give free food to veterans here in Henryetta. So our next one's March the 6th. So there are resources out there to help you. Do not try to do it on your own, just because there's a lot of catches to what goes on what form. And then we can explain the process to you so you're not wasting your time trying to get your benefits.
Yes. Another important thing that our CDC, which is Voluntary Services, has worked with a company that has given us food that all you would have to do is add water and heat source. It could be on a cook stove, it could be a microwave, it could be on a wood fire, literally, to heat food up. Okay. It's very nutritional based. So if we have veterans that are leaving the hospital from Muskogee and they know that they live in a rural area and maybe they don't have a lot of people available to help them at discharge, they can get a food basket. But it also then is when you go to your CBOC location and you talk to your PAC team or your primary care provider, they can get a hold of the social worker that just does a really quick assessment, just puts an assessment in the computer, and you could also get a food basket. So that resource is something that probably has come down the pike about 4 months ago. Okay. So we're very excited about that opportunity as well. Especially important for our rural female veterans.
Yes, and I know a lot of veterans that don't have a vehicle. So we usually deliver about 10 or 15 veterans their food on the day we do feed the vets. That's if they're unable to leave the house because they're housebound or whatever. So that's one of our programs that we have at the VFW. If a woman veteran has any questions about the women's veteran program, can they call you directly, or is there another number?
Yes. So they could reach me via email, which is Michele, Michele. I am definitely a 1L Michele, .Reeves, Reeves, at va.gov. Or my office number is 918-577-4277. Or my work cell phone is 918-577-1958. So any of those. Now, I do caution people that I drive to Tulsa one day a week, usually on a Thursday. Okay. And so give me 48 to 72 hours like today. I'm not hardly in the office at all because we're here doing this. Usually on Fridays is when Kelly and I travel to do the outreach in the rural communities, like when we came to Henryetta. So Friday, usually Thursday, Friday, if you leave a message on Thursday, most likely I'm not going to see that message on email or from my office until Monday morning. So just please give me time to call you back.
All right. On the mammograms, where's the mammogram screening performed for women veterans?
So we're very excited that we were the first VA center. We beat Oklahoma City by about 10 months. And so it's at Ernest Childers at our Tulsa CBOC location. Okay. So it is staffed by female veterans only, and not female veterans, but female personnel. So you're not going to encounter a male. It's state-of-the-art 3D mammography, part of some national funding that we were granted, enabled us to buy these really nice pink shawls that button up the front. So if you're having a mammogram on the right side, you only have to uncover your right breast. This machine also has a button that the lady can compress as to how much pressure she wants on her breast, because we all know that a mammogram is not always comfortable for the female. Yeah. So we're very excited about that program.
All right. Yeah, I'm excited about it too, because I would get my mammogram done at St. Francis Hospital, and then when I go to my primary care manager, she's like, when did you have your last mammogram? And I said, they said they would send it to you. Well, a lot of times they don't. They don't send it to the VA primary care manager.
So that's a good opportunity to segue into, on our team, I have Kelly Zimmerman, who's here with me today off camera. She's my in-reach outreach coordinator. Kelly, how long have you been at the VA? 7-ish years? 7 years, and she worked for one of our main women's only providers, Shirley Savage in Tulsa. And then I also have 2 mammography tracking care coordinators. So they're registered nurses. Miss Stephanie Frink works at Ernest Childers only because we take care of their about 1,350 veterans just at that Ernest Childers clinic. And then Miss Michaela Clark, in addition to being the maternity care coordinator, is also the mammography tracking RN tracker for all the other CBOC, the rural areas, which is Bartlesville, Claremore, Veneta, McAllister, and Idabel. So Michaela knows when your mammogram is scheduled. Now, this is women over 40 years of age.
Okay.
40 or over. So they are tracking when your mammogram is due. They know when you have the mammogram. They're calling that facility if it wasn't done in Tulsa at Ernest Childers, and they're getting the results. They're going to give those results to your primary care provider, usually not the care manager, which is an RN. Mm-hmm. So they're giving it to the provider. If you had a normal mammogram, we have to get those results to you within 14 days.
Okay.
If you have an abnormal mammogram, we are responsible for getting those results to you within 7 days.
All right.
And I'm very proud to say that on PAP, so we'll go ahead and say PAP, I have Tia Miller, who's another registered nurse who also has been at the VA for about 5 years, Kelly.
Yes.
And she also worked for a women's only clinic. So she's the PAP coordinator that basically does the same thing as a mammogram. She knows when a lady is due to have a PAP. She knows where they had it. She's going to get the results. And it's the same time frame. If it's normal, reported within 14 days. If it's abnormal, it has to be reported within 7 days. And on mammography and the PAPs, we have not had any fallouts. So you may tell your RN care coordinator at McAllister, check with the PCP, and those RNs also know to reach out to Michaela Clark, and they probably can do that with you still in the office to get results if you absolutely want those results.
Yeah, because a lot of times, well, they need the old mammogram,
Slides, yes.
to compare it to the new one to see if there's any changes.
And the girls will work on doing that also. I'm going to tell you at least twice, maybe 3 times, Stephanie in Tulsa has herself in her private vehicle driven to Hillcrest to get the last mammogram to take to Ernest Childers so they can compare. I'm telling you, this team that we have, we believe in the mission. We believe in what we do. We have a passion for it. We will climb every hoop we possibly can to try to get you the services or your question answered.
All right. Just for their information, if you're over 40, how often do you have to get a mammogram and a pap smear?
So currently that has just changed, and I contacted Miss Michaela, so let me find it. So now the VA uses United States Preventative Services Task Force on mammograms. We used to do mammograms every year for women over 40. They have switched that to every 2 years.
All right.
However, if you still want a mammogram annually, you just tell your PCP that you do still want that annually, and the care coordinators will get that scheduled for you. Also important, if you do have it every 2 years, of course, at any given time, even if say you had your mammogram in January of this year, and in June you find a lump, or you have an abnormality if you're looking in the mirror, if you have anything that's not normal, breast discharge, pain, whatever you may have, please, 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 it's so important to contact your primary care provider. And then actually, I'm glad this conversation came about, because at Ernest Childers, we can only do screening mammograms. So that's a woman who's going in that had no abnormal sign or symptom. If you have something abnormal, a sign or symptom, you're going to have something that we call a diagnostic mammogram. So we're going to send you to the facility of your choice, where they're going to get a lot more views of the breast tissue to try to figure out what's going on with that abnormality that you have. So I'm glad that conversation came
And
up.
then when you all send them out to a different location to do the diagnostic mammogram, then the VA would pick up that cost, correct?
Absolutely. So you would go through the care in the community consult. So your primary care physician would place that consult. And then the girls still follow even the diagnostic mammograms. If then, let's say the diagnostic mammogram said you needed to have an ultrasound or a breast biopsy, they will also help you coordinate all of that.
I noticed on your slides you had the breast cancer symposium and the breast cancer walk. When is that normally?
So we actually last year held our second breast cancer symposium and walk. So the first one, of course, October is Breast Cancer Awareness Month. So our first one was October the 25th, and the walk then was, so it's usually that third week. The second one, the one that was last October 2024, was on Thursday the 24th, and then we did the walk on Friday the 25th. So what we tell people is we officially walk in at Ernest Childers and at Jack C. Montgomery and some of the other rural locations. If they can get the team out to walk, they walk as much as they can before they can have the next patient that comes in to see. The breast cancer symposium, we haven't had really good attendance. So when we have an event, we send it to, Kelly, correct me if I'm wrong, Okay, Veterans Calendar,
Okay.
which is through an organization that is
The Eagle Ops.
Eagle Ops out of Owasso, Oklahoma.
Okay.
So that's a statewide calendar. Now, we don't just go there. It will be in the newsletter. We'll have save the dates and like a flyer in the newsletters that go out monthly. And then we also give it to our public affairs officer at Jack C. Montgomery, and they put it out for employees. And then they also put it out on the web pages like Facebook and social media. That's how we would get the event out. So we usually, it has been 6 presenters that are usually PCPs, like we've had a general surgeon, our women's health medical director. We had a lady talk specifically about all different kinds of female cancers because we actually can do cancer treatments at the VA. They have infusion clinics at Muskogee and at Tulsa. So even, let's say, if your oncologist, we do have an oncologist, but if your oncologist was at St. Francis and wanted you to get a certain regimen of chemo, you could still come to the VA and get your infusions at either Tulsa or Muskogee clinics, which is a beautiful thing.
Right, and then if the veteran's 30% or more VA disabled, you get reimbursed for your mileage. They'll pay you travel mileage once
Benny
you
travel,
reach,
yes.
once you reach
Yes.
30% disability.
And so that's even to go to a clinic visit. So if you think that you need Benny travel, when you check in with that front desk person, that is the person that could assist you with filling out your Benny travel benefit.
Okay. What are some of the breast cancer myths that you've heard?
So there are definitely a lot of myths out there. Some of the myths are breast cancer is the same. It's very much not the same. It could be concentrated in just one duct of a breast, which would be minimally invasive. It could have already spread to multiple ducts. It could be in the nipple only. There are just many different kinds of breast cancers. Another one is only women who have larger breasts get breast cancer. That's absolutely not true. If you're a woman who's always worn an underwire bra, that could cause breast cancer. That's not true either. So there's just so many myths, but the most important thing to know is nobody knows a breast better than that female. So if you have any abnormality, please see your physician and get it checked.
All right. So basically, all women are allowed to get mammograms through the VA, or not, and not just the ones that served in a war zone and got exposed to toxic exposures or the burn pits. All women are eligible.
So we start actually the eligibility at 40 years of age.
Okay.
Again, now we just switched it to having a mammogram every other year. But remember, if you still want it annually, they'll give it to you. So I'm glad you mentioned the burn pit. The national office has come out with what's called the Service Act. And that is women who have combat service near the burn pits or other toxic exposures. It could be at any age. So the VA, and we're working on calling women under the age of 40. Okay. Given a really simple breast cancer assessment, the first two questions are, when you had active service, were you in combat? Did you serve in combat? If they say yes, it'll be on that assessment in our computer system that tells the exact locations and the dates of those locations. Then the nurse says, okay, well, you're going to qualify for the Service Act. A primary care provider is going to call you and do a very long breast cancer risk assessment. And if that comes back positive, you could be 28 years old. And if you wanted to have a mammogram, the VA is going to pay for that.
Okay.
Because you were in that risk location during that specific time frame. And if you choose to have the mammogram, the VA will pay for it. But again, there are very specific criteria for that to be a paid benefit under the age of 40.
Okay. I just had a question. I went to Baghdad, Iraq in 2008, and the way they give us our drinking water outside of the donning facility is they store it on pallets in the open heat, 120-degree heat, and everyone knows that plastic leaches into the water if it's heated. That's why you don't leave bottled water in the car. Is there anything that you recommend that I could do about trying to get that changed?
So we deal with ladies who are post their service, but what I would recommend, and how the PACT Act and the Service Act is part of the PACT Act, that all came literally from veterans getting with their congressional affiliate people, senators, to really complaining about all of the side effects of burn pit from potentially toxins. They're the ones that then go higher up to Congress to say, you guys need to do a study on this to let that potentially be a recognized condition for illnesses that it may have caused you. Right. So it wouldn't be something that we can help with. So it literally needs to be like your congressman or your senator. Okay. Then going all up the chain to say, I'm just going to give an example, and there's no scientific data to it. I have colon cancer because of this water that I drank. So, right. And then they would do studies, and if they can prove we have 10,000 cases of this, we think that this actually did happen. We have scientific proof, yes, it did happen. That's how changes come about.
Okay, and we do have a legislative forum that's going to be at Shoney's one day a month between now and May that you can go and talk to your congressman directly. So I am going to be awesome. There to mention that. I even know veterans today that went to Afghanistan or Iraq, and they still do the same thing. Bottled water on pallets.
So it's not a condition that they've changed.
No, they have not changed.
I haven't been a veteran, so I don't know. And I don't know how, barking up your chain of command obviously probably doesn't help, because I know there have been plenty of people who have verbalized that concern, and it sounds like they haven't changed the practice.
No. And I wanted them to ship me a bottle of that water over here, and I'd test it. But the problem with that, going through customs, they don't let any liquid come through customs. So I wasn't able to test that water. But I'm sure that there's something affecting soldiers by giving us that water to drink. So, and a lot of veterans don't know that plastic will leach into that water if it's in your car or sitting in Iraq. It's right. Not good to drink water like that. Okay, can we call Dr. Kate Hendricks about the Service Act to resolve the issue of what we just talked about, our contaminated drinking water, which you just said I need to contact the congressman?
Right. Okay. So unfortunately, Dr. Kate Hendricks actually passed. She passed
Okay, I
from
didn't
breast
know that.
cancer, like stage 4 breast cancer, I want to say at age 42. And that is one of the main reasons the Service Act actually come about, because she served during the time of burn pits, and the toxic exposures was the only thing that they could say was the main contributor to her stage 4 breast cancer disease. And she lost her life. So again, just the senators, but she was very active with Congress, and she's really the one that was instrumental in getting the Service Act for our female veterans.
I didn't know that. And she was so
Yes.
young.
Yes.
42 years old. In the mini residency training in women's health, what is the innovation, diffusion, organizational change?
So any kind of organizational changes, we even have our own team now called the HIT team.
Okay.
So it is active changes. Other industries other than healthcare have just culture. Just culture would be if you see something that you think is going to harm another person, you have the authority to speak up to try to get that to change. There will be no punitive retribution. You're not going to get in trouble at all, because even if it was a near miss, we want to investigate what happened so that we don't potentially harm anyone. It also is lean process, things like a Gemba walk, going to the floor, going to where the work is done, to try to and talk to those frontline workers to see what issues are you having, what issues do we, and we have a very active quality department in Eastern Oklahoma healthcare system that works on all of those process changes that benefit not just female veterans, but literally every customer that walks through the VA door. That's what that whole change process is, to benefit every person. And it benefits employees as well in the process. So it is just change. And it's very important to our upper management leadership that we have a facility that is like that. We do not want people to be ashamed. They actually call it stop the line. If you see something, you can have the authority to stop the line right then if you think somebody is going to be harmed. And they praise you for doing that.
You talked earlier about the maternity care coordinator, Michele Clark.
Mm-hmm.
I was reading some information. So you all provide different types of equipment for maternity. What kind of equipment is that?
So as soon as the lady finds out she's pregnant, I said they send the purple book. Michele then, I'll kind of tell you the process and we'll go through it. So Michele keeps in contact with them every 3 months. And then she also follows them for a full 12 months after the lady delivers her baby. So she screens them for things, home insecurities, food insecurities. Are they depressed? Are they suffering postpartum depression? She can help them when they first find out they're pregnant. Let's say they're having body aches and pains. She can get them a pregnancy pillow. She could order them, it's called a belly band. So if your belly starts getting heavy later in pregnancy, that will help raise the belly so your belly and your back doesn't hurt. There's also then a postpartum band that she could get. A breast pump is paid for. If there are issues with the breast pump tubing that need replacing, she can help with that. They would provide a nursing bra, nursing pads, just literally. Now that comes from the prosthetics department, but Michele can put that consult in, and those items would be delivered to the lady's house. So she wouldn't even have to go to her clinic to get them. They will be delivered to her house.
That's awesome. Having an extra benefit of the equipment for maternity. That's awesome. You mentioned prosthetics. If any veteran, not just women veterans, if they need a ramp built to their house because they have steps and they can't go down steps because of their disability or whatever, they can request a consult through their primary care manager to the prosthetics department, and then they would decide if you were eligible to get the ramp to your house, or if you have trouble getting into the bathtub and you want a walk-in shower.
Yep.
They would pay, if you were 100% disabled and it was approved, the VA would pay up to $6,800 for that veteran to get a walk-in shower put in their house. And then also, not just the walk-in shower, but there's all kinds of other inserts in your shoe, other items to help you make your life more comfortable.
Walking devices. If you have surgery, like a walker after surgery, or a 3-pod cane to help you walk, crutches. The prosthetic department is huge. It's huge in what they can offer the veterans.
On the shower, also if you're just 50% VA disabled, they will pay up to $2,000 to install a walk-in shower. So that benefit, as far as the shower goes, does depend on your level of disability as to what they would cover, the amount that they would cover for a walk-in shower. What kind of services does the perinatal reproductive education planning and resources provide to the women? Is that what we talked about earlier as far as the equipment and then the counseling?
Yes, it is. So yes, the counseling and the wraparound services. Now, the reproductive health office of women veterans locally, and it's a clinic that we have at 11th Street in Tulsa.
Okay.
They have individual or group sessions. It could be, again, infertility, pregnancy loss, women who have undergone cancer treatment. They've lost a breast. They've lost a uterus potentially at 35 years old and never had a chance to have children. I mean, that really affects a woman and every individual differently. So as part of our WISE funding, which Congress gives Office of Women's Health, we can apply for extra positions that help every woman veteran. It could be a provider, an RN, an LPN, but there is a new psychiatrist for that women's health team on 11th Street that was just hired on. So they have also filled out for about $60,000 worth of very specialized training that they will get certified in to provide the women veterans. So as part of the Prepare program, that the mental health specifically for women veterans is growing massively by the services that they provide our female veterans. And that would be something as simple as talking to your primary care provider when you go in for just a normal visit. And, the big thing, hopefully women are hearing the question from Whole Health, rolled it out, what is important to you? Because your provider may be trying to help you with hypertension. When you're not worried about hypertension or your high blood pressure, you want to be able to walk solo or with minimally invasive assistance to go to your granddaughter's wedding that's going to be in 4 months. So they need to focus on what's most important in your life and not what the provider potentially has set out that they want to help you with. So again, a very active team of Whole Health that we have at Eastern Oklahoma. They are doing incredible things. Like we have we're number 5 in the nation, and we're certainly number 1 by leaps and bounds in our VISN 19, which is 8 different facilities. So just very active Whole Health. So if one of your veterans wants to know more about the Whole Health model, they also have classes. They have chair yoga. We're hoping, we actually in February are starting a yoga class at the Tulsa. If we get enough women veterans to participate in it, the instructor that is very anxious to actually have a virtual. Like we could do something, she has trained people that were even paralyzed from the waist down and in a wheelchair. So it would be literally yoga for women at all capacities physically to do. So that if we can get the participation at Ernest Childers, we're definitely looking at doing something virtually that would serve a wider base of women veterans. So again, very active. They have a lot of classes for whole health for men and women veterans.
All right. Also, if a veteran needs medical equipment, we do have beds, walkers, shower chairs, different things like that at our VFW here in Henryetta at Post 539, and they're welcome. They don't have to be military, they can be civilian. So if you're in need of any kind of medical equipment, give us a call, and we'd love to help you with that equipment. Also, on the transportation, are you aware of any transportation services that a women veteran or any veteran can call? Like, I have a couple veterans that have had seizures, so they don't have a driver's license or they don't have a car. Is there any, besides Boys or the Cat Bus, is there anything that you're aware of?
Kelly, you can help me with this. As far as I know, we have local transportation in Muskogee proper and Tulsa proper, but when you get into the rural locations, it's the VA doesn't pay for a transportation person to go in the rural location. Unfortunately, that's not offered yet.
Okay.
And even though we know that is a big need.
Yes, the only thing I'm aware of is that the Cat Bus will like take a veteran from Hoffman to Okmulgee to dialysis and that type of thing, and it's $2 a trip for that. But I don't know what area that actually covers other than Hoffman to Okmulgee. So, and I know soon if they had Sooner Care, that they have a transportation program there that would help them get to their doctor's
Now,
appointments.
sometimes too, some of the VSOs will have somebody that would volunteer to say, because I've seen it happen once, they went to their local VFW who had a volunteer that took that person to a same-day surgery appointment, because you have to have an adult with you after the surgery to drive that person home then. So that has happened once. So I don't know if that's something, we have an exam, we can't, as a VA healthcare system, I can't solicit that service. We just aren't allowed to do that.
Right. Okay. My Healthy Vet is basically an online access to VA healthcare, and it's www.myhealth.va.gov.
So at the end of health, just add an
Okay.
E.
Oh, okay.
My Health E.
.va.gov. And can you explain to our veterans how does that program help them manage their health care?
So part of My Healthy Vet that was extremely important, and especially to women veterans, is they can sign up for that, and then they could secure message their PAC team. So it's usually actually the RN or the care manager, as some people called it, you had called it earlier in the conversation, will get on that secure message, and if she can solve the questions, then the RN solves the question. If it's something that she needs to get the PACT provider involved in, then she would get the PACT provider involved in that as well. So the secure messaging, instead of having to call the main number to Ernest Childers, and then you're transferred 5 to 6 different times, which is very frustrating to anyone, you can go straight to the source, which is your PAC team, to send a message of, I fell and I think I need an x-ray of my ankle or a knee or an elbow, or I just need refill on my blood pressure medication, or I would like a consult to see. Some of the consults they can give without seeing you. That's still at the discretion, of course, of that primary care provider to say, yes, I can put this consult in without seeing you, or we need to schedule you for an appointment. I really need to see you before I put a consult in for cardiology. That's just an example. That may not be the case. So again, that's a discretion, but literally being able to, on the computer, send that secure message directly to your primary care team, and they have, Kelly's at 72 hours? 72 hours to contact. So 3 days, you should hear some kind of Thank you for the secure message. I have forwarded this on to your primary care physician who will be working on this. And then, if you don't hear something in 3 days, then I would encourage them to secure message the PAC team again. But it's just quicker service instead of being, just
Transferred
handed
away.
off to all of these different people, because
Yeah.
nobody wants that experience for a veteran.
Yes, and also when you do a VA claim, and I help you do your paperwork, you can use those email messages to your doctor. You can actually use that as evidence that you reported you had a problem, whatever the condition was. You can use all that as evidence. So you don't necessarily have to be in their office to use that documentation as evidence that you have a problem with whatever condition it is. You can still use that evidence through My Healthy Vet. So that is a good program, and thanks for telling me. It is www.myhealth with the E after health.va.gov.
Yes.
Correct. Okay, thank you very much. On the VA healthcare, can you kind of explain what the basic eligibility for that is, because it's changed over the years?
And it continues to change. So I don't really have a lot of the eligibility. Usually what I tell people is, if you have questions, come to the business office, either in Muskogee or at Tulsa, because the business office people, I don't keep up with all the benefit changes. They know the latest and greatest benefit changes and updates than I would know. So literally, and if they need help on that, they can call me, and they usually tell people they're usually not so busy that they can't just walk in and see a representative, or if they're coming from a long ways, we can set up an appointment. Like, this veteran is coming from Idabel, Oklahoma, because that is in our catchment area, and we're going to make it Wednesday at 9:00. So we're not keeping that person who is potentially driven for 3.5 hours. We can get an appointment with them, and they can walk back and visit with the representative. I know it has to do, I've had veterans upset that they've gone to the business office to try to sign up, and they're like, well, you continue to make more money than what you should, so they will give you partial benefits. So I don't know all the rules and regulations for that.
Yeah.
I really don't. I apologize for that.
Well, one that I do know on that is you have to have a VA disability to be eligible to go to the VA hospitals to seek health care, except for mental health.
Or something that is the result of military sexual trauma.
Okay, so military sexual trauma or mental health issues, you can go see the VA whether you have a VA disability or not. Now, if you do have a VA disability percentage and you pass away, that is what makes you eligible for the $2,000 in burial benefits. But you have to have a VA disability in order to get that $2,000 burial benefit. I can help you with the paperwork as far as ordering the headstone or the footstone. You're still eligible for that. But as far as the $2,000 that they pay for burial benefits, the veteran has to have a VA disability of some kind.
And they always say adjudicated condition that the V has set forth that was a result of their service.
Right, that was a result of their service. One other thing I wanted to tell you about, which I just found out literally a couple of days ago, if you have, say for example, you have 100% VA disability, and one of those service-connected disabilities is not hearing, but you need hearing aids, you can still go to the VA hospital and get hearing aids. You get a new set every 5 years. They'll mail you batteries in the mail for your hearing aids. So just because you don't have a VA disability for hearing loss, you're still entitled to get hearing aids at the VA hospital.
And I did call my main person in the benefits department. She said, absolutely, yes, it's paid. And then all costs associated with the hearing aid. So, yes.
Right. So that's a valuable benefit for people or veterans that cannot hear. I've had them tell me last week, I don't think I can get it because I don't have a service-connected disability for hearing. So I checked this week.
And I checked also.
Sure enough,
yes.
You can get hearing aids all day long, whether you have a VA disability, service-connected disability for hearing loss or not. but you
Yes.
do need to be eligible to go to the VA hospital.
Right. So you have to have your card for VA healthcare.
Right. So you do have to sign up for VA health care. The question I had is, who can benefit from the reproductive mental health services? Are you familiar with that?
Literally anybody. So that's actually one of our brochures that we have. We're going to get these. The order has, order has been placed. And when we get them, actually, where they're in color and they look beautiful, we're going to bring those to Tricia so she can put either in DAV, wherever you think the women veterans need them. So it's very specific. So reproductive services, the VA pays for infertility benefits. There's a consult that's placed. It's for any veteran, male or female, that would do testing to try to figure out why you're not able to conceive. It would be one of the criteria is, as a female, you have to have your own eggs. As a male, you have to have your own sperm. For some reason, if you do not, you are responsible for paying for surrogacy or to buy eggs or to buy sperm. But the 1330 then would pay for IUI, which is intrauterine insemination. So they would take sperm, clean it up, insert it into the uterus to try to get pregnant. If that did not work for that couple, so it could be a male veteran who's not able to get their wife pregnant. They have to have an adjudicated service condition that's preventing them from getting pregnant. We have a committee that goes through. There's very distinct criteria that has to be met to go on to the second stage, which would be, again, the woman has eggs, the gentleman have sperm, and then they could do the ICSI, literally putting the sperm in the egg to make embryos, and then transplantation of that embryo into the uterus to see if it takes. Now, there's also criteria like the IUIs, they can only have 3. The transfers, they can have like 3 cycles to try to make embryos. They can only have a certain amount of implantation into the uterus, and then once you exhaust that, then the VA is not going to pay then for that condition. The spouse of a male veteran would have what we call a collateral account, have a collateral chart. So if she needed medications to make her ovaries produce eggs, then that is something the VA would pay for. So currently, the institution that works best with our VA system is OU Infertility Clinic in Oklahoma City. And actually, there were like 2 clinics in Oklahoma City that recently closed. So we're very, very limited. But the OU Infertility Clinic, we have had success with veterans actually getting pregnant and having a viable pregnancy, which is exciting. This is not a quick process. If you start this process, there are hoops to jump through, which we can help you with that. So please don't think that you're going to contact us and all of this stuff is going to happen within 30 days. They're just, you have to dot the I and cross the T, and very, very distinct. A has to happen, B has to happen, C has to happen, D has. It's very systematic on that process, but it's certainly something that we can help the veteran walk through.
Okay, and one other thing I wanted to mention on that, there is a condition called erectile dysfunction.
Yes.
And a lot of conditions cause that. It could be depression, it could be PTSD. So if you do have issues with erectile dysfunction, you can actually file a claim for that. And even if you didn't get a percentage for that, which you could get up to, I believe, 30% for the erectile dysfunction, even if you didn't get a percentage for that and they give you 0%, you can still get that special compensation pay, which is about $134 a month.
And Tricia, those are the kind of things when we have a couple that is applying for infertility benefits, we have to go in their chart and see that they were on this mental health condition while they were in the service for this. It has to be in that chart because we also have to copy and paste whatever medicine, whatever their condition was in their chart to verify why we're approving the VA to pay for this infertility benefit. So it's very important for them to have the diagnosis, or to at least the provider, once they talk to it, it's important for that provider to document that conversation that they've been trying for 3 years to get pregnant and haven't been able to. We need that proof in the chart for the VA to pay for infertility benefit.
Right. And so basically what it is, it's having the loss of a creative organ is what it's referred to as in Title 38. And that's how you are able to claim erectile dysfunction if you've been diagnosed by a doctor. The key is you've got to be diagnosed by a doctor, and it has to be a current diagnosis within the last 2 years for me to file a claim for that.
We do at Muskogee, unfortunately, only have one provider that's a urologist, but they do have physician's assistants in the clinic at Muskogee, at Jack C. Montgomery, that could also help start that process if you have erectile dysfunction. If for some reason you're in an area not close to Muskogee, then that is something, of course, we could put a consult in for care in the community.
Right.
If it's something that we can't get the veteran in a timely manner.
Right. And then the care in the community is basically the VA's referring you to a different doctor outside of the VA. You can still get paid mileage for going to that civilian doctor as long as you have a referral from your primary care manager to go to that community care. Is there any other information that you wanted to explain today to veterans?
One of the questions you had we haven't covered is the number to the the National Call Center. So that number is 855 VA Women. So the hours, it's open Monday through Friday, 8 to 10 p.m., and that's Eastern time. Saturday from 8 a.m. to 6:30 p.m., again Eastern time. Calls are answered by women veterans. They've been there, they've done it, they've been in the call center for a long time. I can guarantee you that nationally they know the answers better than even I do, where I have resources sometimes that I have to reach out to find the answer for something that a woman veteran wants. These ladies, they know the answer. If they don't know the answer, they will put it in a form and it gets sent to me, and then I will call that veteran and say, hey, I've received your query from the National Call Center, and I'm going to reach out to the social worker. I'm going to reach out to Whole Health. I'm going to contact your PAC team. I'm good. Because sometimes the veterans need to know that's when My Healthy Vet comes in and the secure messages. It could have been something as simple as if you would have secure messaged your PAC team, they could have handled this for you and caused much less frustration for you. So I'm open, transparent, and very honest with them. I usually tell them, hey, I'm reaching out to this person specifically. Again, give me about 72 hours for me to, find the answer to your question, and then I will call back. It's sometimes I may have to reach out to a VISN level person, or I may have to reach out to even our national team. Like we have a reproductive national team. There's a comprehensive health national team. The VA is very good with women veteran program managers that we have monthly and quarterly meetings. So anything that's new that's rolled out at the national level, they're very good at communicating those things with us via the meetings that we go to, which is great, because I don't want to hear something that I didn't know about. And they're like, oh, well, Michele, we rolled that out 3 years ago. But there was no way that I had to find out about it until a veteran potentially. That hasn't happened yet, but I don't want that to happen. Exactly. So lots of good education for women veteran program managers, a lot of networking. We have usually an annual meeting that all in the United States WVPMs get together and have a meeting. So a lot of networking, like I have this issue in Oklahoma. Do you have it in California, or do you have it in Colorado? So it's just wonderful to meet with like-minded professionals to see how they handle certain situations. So again, just it's been an honor to have this time for the veterans. And please, if you have questions that come in specifically from women veterans or even male veterans, it's not like if a male veteran asks me something, I'm going to say, well, I'm the Women Veterans Program Manager. I'm not going to help you with that. That's not at all how we would treat anyone. We're going to treat everybody with dignity and respect, whether you're male or female. But if you have more additional questions that have come up from this conversation, I would be happy to come back in 2 weeks or 30 days, whatever needed to be done. Okay. Again, I'm going to show them. I've kind of typed out my answers. So I'll clean it up a little bit and make it look pretty. I will send it to you, and you probably could attach it somewhere that then they can kind of read if they didn't catch something, or I might have forgot a detail that I have typed in that we didn't discuss during the conversation. Okay. But I would be more than happy to come back again if the veterans need that. Okay. I would be happy to do that.
All right. Well, we appreciate you coming today to educate women veterans on their benefits and your programs, because you taught me a lot. I've been doing this for 6 years, helping veterans, but just reading your slides, I learned a lot myself in what you told us today. So we appreciate you taking the time to come out down and help women veterans.
It was an honor. It's always an honor to care for our veterans. I mean, anybody, I will tell you, at Eastern Oklahoma, we have a passion for what we do, and we love our jobs. We're very happy and honored to care for our veterans.
Well, thank you so much, and thank you all for watching The Guardian of Services.